aging actually starts much earlier in life. But it does not mean that we cannot change what is happening today. And that is one of the biggest myths that we talk about. So I did, no, okay, I was doing it the wrong way. So the biggest myths, and I'm gonna ask you all to tell me what the right answer is at the end of the talk. So the biggest myth is you can't teach an old dog new tricks. Aging means inevitable decline. Memory loss is inevitable. Older adults are lonely and isolated. Which one do you think is true?
Well, they don't have to.
All of the above.
They don't have to be true.
None of the above.
None of the
None of
above.
the above.
We can change all of the above. We can change all of these. We can change all of this. So I will talk to you like I talk to my patients in the office, and then one of them happens to be here, if I'm not violating HIPAA. But the thing is that as a geriatrician, what am I focused on? My focus is truly on like how well you live, whatever age you are, whatever medical conditions you might have, how well you live the next 5, 10, 15, 25 years of your life. And what do we focus on as geriatricians? And we'll ask you the same questions almost every visit, but there is a reason for it. Because the decline can happen very fast. As early as 3 days of immobility can cause you to decline. So mobility is always number one on our mind. And why? Because the number one reason for anyone older than 65 to go to the emergency room is a fall. So it's not usually your heart, it's not usually your lungs, it's not usually anything else but a fall. And why? Because balance becomes a problem as we get older. And why does balance become a problem? It's because we are not exercising as much, we are not as mobile as we were when we were younger. And why does that matter to us? It is not just that we want to prevent a fall. Obviously, we want to prevent a fall because we don't want you to get injured, we don't want you to break a hip or bleed into your head. But mobility also defines how you're going to hydrate yourself. Will you avoid getting up and getting yourself a glass of water? Will you avoid getting up and going and making yourself a meal because you can't stand there and cook? So you avoid it and you don't eat a meal? Will you avoid going to the supermarket to buy groceries for yourself? So all of those are bigger problems for all of us. So that causes another cascade that we worry about. Are you not eating enough? Are you dehydrated? Are you losing weight? If you lose weight, you lose more muscle. So then it becomes a very vicious cycle. So mobility for us is the biggest thing that we talk about. And if you recognize or you don't recognize, but CMS recognizes that along with the physicians, which is amazing, that's the reason they give you the benefit of physical therapy. Because they do want you to move. They want you to continue to stretch and move. And what is the easiest, simplest, cheapest exercise that anyone can do? Walking. So a very educated group here then. So walking is the simplest, cheapest, easiest exercise for all of you to do. It does not mean that you have to walk 10,000 steps a day. That is not the only thing. That is an aim that if you can achieve, wonderful. But you do need to strive. If you were walking 500 steps yesterday, walk 550 today, 750 in the next month, and then 780 the next month. So whatever works for you, mobility is really important. What I tell older adults, if they are able to, and if they don't have other medical conditions, tie 1 pound ankle weights on both your ankles and then walk. Because it also causes muscle stretching, which is important because stretching of the muscles makes them stronger. and also causes your bone to be stimulated to make more bone, so you don't, which happens, thinning of bone happens as we get older. So all of these components are very important for us. Bones, your muscles, mobility, and why mobility? Because we don't want you to fall. And we also want you to keep yourself hydrated and eat well. And after mobility comes what?
Yes.
It's gonna be the next one.
Mind.
The mind. Mind. Very important. And you know, we talk a lot about heart health, and as a country, we've all seen that there is a lot of heart disease, right? A lot of heart disease in this country. People who are younger are now, you know, we've had a lot of younger patients have sudden cardiac deaths. This is one of the problems. And I think the problem is truly in the food we eat. There's a lot of processed foods that we eat in this country. So we want to focus on fresh fruits and vegetables, lean meats, and avocado or olive oil. So if you can focus on those, Mediterranean diet, low salt, focus on that, that is very important. But the second M that we talk about as a geriatrician is mind, and the most important thing about the mind is what we talked about, is the loneliness, right? Again, the loneliness is affected by your mobility. It's all connected. If you don't move and you can't get out, you will feel lonely, right? Because you can't get out, your children cannot come and visit you because they're working 2 jobs and trying to build a life, or they have odd working hours, and then you're not able to see them enough, or you're not able to see your friends because they are not as mobile as they were when they were younger. It definitely breeds loneliness. But loneliness, why do we worry about it? It's the same cascade. Loneliness causes you to be anxious, depressed, eating less, moving less, falling more, utilizing the emergency room where you're probably going to get another infection. So this cascade is another thing that we really are worried about. So how do you avoid any of this? How do you avoid any of this? Very important. It's so important. Socialization, small talk, meeting people. When you're walking up down your street, talk to people. It does not matter what conversation. Small talk actually, in a recent study, showed it decreases the incidence of dementia. And what is dementia? Dementia is memory loss, cognitive losses. And so talking to people, coming out, going to adult daycare centers, and that is the reason they're here. You know, coming to a center like this, meeting other people, socializing, you know, meeting people for coffee, meeting people for lunch, meeting your friends, going to visit your friends. So it is very, very important. The untreated anxiety and depression also causes memory loss as we get older. So truly important that we are paying a lot of attention if we have anxiety or we have depression, that we seek treatment, because it does cause memory loss as we get older. So what are the ways that we talked about to keep your mind healthy? One she mentioned was socialization, coming out, mobility, eating healthy, doing brain games, and I heard that they've started a new program here where they're doing healthy brain, some exercises, the exercises of the mind. Yes. And you know what, I forgot to mention, they also told me that they have a Tai Chi program, which is very good for your balance. That is very important for your balance. Tai Chi is very good for your muscles and very important for your balance. So when we talk about mind and brain, we talk about 3 things that we also talk about your heart. We talk about healthy eating, which is fruits and vegetables, lean meats, which are turkey, fish, and chicken, and healthy oils like avocado and olive oils. The second is physical activity. The third is actually medication that I worry about a lot for our patients, because there are a lot of medications that people not knowingly take, which is a lot of sleeping pill that people are taking over the counter, which has Benadryl in it, or called a diphenhydramine. Diphenhydramine and Benadryl is the biggest culprit that makes you fall, causes confusion, chronic constipation, urinary retention, and affects your brain. So causes memory loss in the long run. So if you have trouble sleeping, please talk to your doctor. Benadryl is not the answer. It is really not a good drug for, the reason it is over the counter is because it is an emergency drug for allergic reactions. And so we don't want it to be behind the counter so you can't get it, but we also don't want you to use it liberally. The other class of medications that I actually worry about is also a medication that a lot of elderlies are on it, and please discuss it with your doctors if you're on it. It's called the oxybutynin, Vesicare, Detrol for urinary incontinence. That medication, that class of medication also causes you to drop your blood pressure, makes you fall, constipation, urinary retention, and actually dementia. So it is very important. The third class of medications that we worry about is Xanax, Ativan. That is, it is called the Band-Aid of anxiety and depression. So when we used to treat, I'm just going to give you an example. When we used to treat heart disease in the back in the older days, we used to use water pills as like they were the treatment for heart disease. But we have such great medications. People who are controlled, we don't need to use the water pills. And we give water pills as and when they have an exacerbation of their illness, or if they really have severe heart disease. Same way, Xanax and Ativans, which is lorazepam, clonazepam, alprazolam, Ambien is in the same class. They actually have a problem. They actually cause brain cell loss, and they cause memory loss. They also have the similar side effects. So I really want you to pay attention to all of these medications. If you take them, or if your doctor is prescribing them, there might be a need for a short period of time that you might need these, but talk to your doctors and say, you know what, do we really need this? Can I change to something else that is better for me in the longer run?
But those drugs are addictive, so
Absolutely.
by that time, you may not want to ask him to take them.
You know what, now that in this day and age, if somebody comes to tell me that I'm addicted to this medication and that we have medications to get you off that medication so you don't suffer through that transition.
So that's more medication.
No, but you will not need that medication in the long run.
Oh, okay, just to get you off.
It's just to get you off that time when you are transitioning off of that drug that you need that other medication. And I mean, in this day and age, if somebody is telling you that you need to continue this medication because you've been on it for so many years that you need, that's a wrong thing.
And then if you get off and you get sick, then what happens?
So if you, let's say, okay, what happens when your blood sugar goes up when you are diabetic? What happens? You're stable on medications, let's say you are taking your pills, 4 pills, whatever it is, you're on it, but then there's a breakthrough. One day you wake up and your blood sugar is 600, what do?
You go to the ER.
Exactly, what do they give you? They give you the insulin, right? Exactly. So the same thing goes on with this. Whether it's anxiety, whether you're using it for depression, what other disease you're using it for, if it is stable on a medication, there is always a chance that it is going to go up and down, right? You might have a stressor in your life. You know, it could be a death in the family, a loss of a pet, or anything that can exacerbate that illness. Doesn't mean that you might not need that medication for a short period of time again, but it is the prolonged use that is actually causing you to have a decline in your mental health. And you can say that you've been on this drug for so many years, Well, you were also so many years younger at that time and you
Right,
started,
right,
right?
there you go.
So your body, physiologically,
Yeah.
anatomically, everything is changing.
That's what I'm saying.
So you cannot metabolize those drugs the same way that you were able to when you were
20 years
younger.
ago, right.
So you have to also analyze, your liver is getting older, your kidney is getting older, your heart is getting older, and so is your brain. So if you are going to expose the same dose, same drugs to the same, but you're not the same.
Right. I got you.
So it is very important to discuss. And it's not necessarily that everybody can come off of every drug, but if you can lower the dose, even that will help. Goal always remains the same. Reduce your falls, reduce the medication as much as you need. You take what you need, minimize otherwise, to keep your heart and brain healthy. So this is what we were talking about when we were talking about loneliness, your brain health, how to stay motivated. You want to come in? Please. So how do you stay motivated? And you do need to find something to do for every day. So what I tell my patients is schedule something for the next day that you're going to get up and want to go and do. So having a schedule is very important. You can't say, oh, I'll decide what I do in the morning. No. You gotta decide the way you used to do it when you were younger. You had a plan for the week. You gotta keep a schedule. You just have to have a schedule. You can say Monday I'm gonna do this, Tuesday I'm gonna get up and do this, Wednesday this, Thursday this. And yes, Friday you wanna take a break and be home and do your laundry, but that's fine. But get up and do something. You have to have something in your day that you wanna get up and look up to do. Whether it's meeting your grandchildren, whether it's going to meet a friend for coffee, whether it's coming to this center, going for an exercise class, or that mind games class, whatever it is. But it is very important to motivate yourself. And when we say the loneliness that we were talking about earlier, there is a saying in medicine, and most of the doctors will tell you, when you're actually medically sick, we tell you to go and rest. But when you feel lonely, anxious, or depressed, the one thing that is going to help you is movement. Get out of that bed. Get out of your chair. It is those two things are like when you're down with the flu, you have COVID, when you have your CHF and you're having a pneumonia or anything, we tell you take your rest. But even then we tell you when you're able to walk. But when you're lonely, anxious, or depressed, there is one thing that generates endorphins like nothing else is walking. Get out of that bed and walk. Listen to your best favorite music, but walk. Put on that music and dance. Movement is the only solution to loneliness, depression, and anxiety. I am sure all of you love music. Go home after dinner, put on that music and dance to it. Nobody needs to watch you. Or watch yourself in a mirror. That's even better. This I think we already talked about, but I think I'm going to stress a couple more points is when you go to your doctor, you've got to be your own advocate. We all know that as doctors we have only very little time allotted to every patient that walks into the door. But if you go prepped, you have your medication list on you, you have your questions that you want to ask your doctor, you want to find out about the resources that are in the community for X, Y, or Z, like, I want to do more physical activity, or I want to do more mind games, or all of those questions, if you put them in one place and go to your doctor prepared, believe me, you'll get a lot more out of it. And you do need to review your medications with your doctor. And if the doctor's running out of the office, please tell them, I want to go over all of these medications with you. Do I need everything? Do I need something better than what I am on? Or can I take away something? Please, you've got to be your own advocate. The other thing that I really stress, I think we already talked about medications. This is another important topic that I really want you to talk to your doctors. Because right now, all of you in this room would know what is best for you. There is nobody, and I know there are kids of people in this room, and I'm gonna say, there is no one who knows you better than your own body, yourself. So please make your decisions. What would you want for yourself in case of an emergency? It doesn't mean that if you think about it or you write it, it is going to happen. That does not happen. We do need to know who is going to make our decisions for us as we get older. I could be a car accident getting out of here. Age is not a factor here. And the first person who passed away with COVID in New Jersey, in Bergen County, guess what his age was?
What?
27 years old.
Wow. This is a child.
So age is not a factor. Yes, we have more chronic diseases as we get older. Our perspectives change as we get older. Our community narrows as we get older. But even when you are as early as 18 years, you need to know who's going to make your healthcare decisions for you when you get sick. How many of you here have a healthcare proxy? Excellent. Wow, that's an amazing number. That is an amazing number. It is very important. Very, very important for somebody to know what you believe should happen to you when you get sick. It could mean, it could be as simple as you're in a car accident, you're not able to give consent. Who consents for you to get a blood transfusion? Who consents for you to go through surgery? Nobody's going to touch you if there is no consent.
Right. You is something.
Who consents for you? It is as simple as that. We're not always talking about end of life. And if you have a belief about your end of life, you should be able to put that down, and your proxy should be able to honor it. But really, it is about what happens to you immediately when we are on the scene. What does the EMT do? So they need to know.
Procedurally, that healthcare proxy, that is a document.
Exactly.
And where is the source of that document? And if anyone who's here needed it, how do they go about it?
Okay, so New Jersey has made it the easiest. You go online, 5wishes.org. I can print it out for you. 5wishes.org. Don't need a lawyer. You don't need to spend money. They have made it so simple in New Jersey. You don't even need a notary. Anybody in this room can be a witness for anybody else as long as they're not their healthcare proxy. So if you wish to write, like I have a healthcare proxy, and it's 5 wishes. I haven't gone to a lawyer. I haven't spent $30,000 because $30,000 bill will be in your locker, and I can assure you it'll be in your locker. Nobody's looking at it. That document needs to be reviewed every year. It should be a living, breathing document, and you could change. Your wishes could change from January to December. You could want something totally different. So I have a healthcare proxy, which is my 5 wishes.
Can you repeat the name again?
5 wishes. 5 wishes. WISHES.
Five wishes.
5 wishes. So there is another document. It's called Prepare. Prepare is also another company that also is honored by New Jersey. Prepare or 5 wishes. Either or is very good. But let me explain it to you. So I have it in that, like it's going to be my husband first, then it's going to be my daughter, and then my son. And then it gives you other scenarios, right? And they can be very confusing because you're non-medical personnel, but they have brought it down to a 3rd grade level. But even then, you could be confused about it. Like, I don't know what I'm going to want to do this. But bring it to your doctor. Discuss it with them. Let them help you make those decisions and answer those questions for you. But at least that first part of it, like who's gonna make my healthcare decisions for me, is very important. Now I know my husband, so I know if I have one cell left in me, he's gonna keep me alive. So I have very clearly documented what I would want him to honor, and I have written there. I said, I'll come back and haunt you if you keep me alive. So I will know. It's truly about it. It's not a joke. But healthcare proxy, the role of a healthcare proxy is to honor your wishes. So please choose your healthcare proxy wisely. Somebody who you think is going to honor your wishes is the person who should be your healthcare proxy. And obviously it is hard. Those moments are hard as we are going through, somebody's had an accident, it's a very emotional scene, family's all upset, the patient doesn't know what's going on, the doctors have maybe few moments to take care of you, and we are all piling on you, and it's like, you need to make a decision right now, and it gets very hard. So those are very difficult moments. But if you've had this conversation ahead of time, you've at least, or it's documented, it becomes easier for you.
And it takes like the responsibility off of that other person because they know that's what you
want it. Absolutely. You said it so well.
Yeah, and sometimes you have other family members that don't want the person you assign to do what you said. Everybody has their opinion.
Absolutely. So you can actually state it there that I want my healthcare proxy to honor my wishes and not change my wishes. You have the right to say that. And in fact, there is another form which we call the PULSE form, which is really the orders, that is translating your healthcare proxy or living will into orders, physician's orders, that EMT or any nurse can follow, which we call the PULSE form in New Jersey. In fact, there you can write, do you want your surrogate to change your wishes or you don't want them changing your wishes? So there is a question about it.
I didn't know that was.
Yes, there was a question.
So logistically then, fill out the proxy. What's good behavior? You want to talk to the person?
Absolutely.
They should have a copy of it. What do we do with all this paper?
Exactly. So the first, 5 wishes, you can upload it into the 5 wishes portal. And that actually, you can do it online. You don't even need to print it out, but you can print it out for yourself and give it to your family members or whoever the healthcare proxy is going to be. But you can do it online and anybody can access it nationally anywhere. So the most important person that you need to give it to is your primary care physician, or if you see your cardiologist more, make sure your cardiologist has it. Maybe if you see your gastroenterologist more, they should have it. And then the people that you assign, they need to know what your wishes are. And it is truly important that if you are comfortable talking about it, very good. If you're comfortable talking and your children are comfortable or your family members comfortable listening to it. So I have this running joke in my family. On Thanksgiving, I go over my healthcare proxy. My husband has still not done his healthcare proxy, by the way. I have my healthcare proxy, which I go over every Thanksgiving with my children, because that is the only time I have attention. They're all on the table. And they've been hearing me since they were 10 and 12. So my son now, one of the Thanksgiving, he says, okay, Mom, I'll just put a pillow over your head. That'll be the end of it. But it is, so my goal is that I do need them to understand. I see what can happen. And so I know exactly what I want for myself. And I do want them to be able to honor my wishes. And my goal of repeatedly talking to them is that they should feel comfortable making that decision when the time comes. So it is not, it is never a one and done, right? I am 57 right now. When I did my healthcare proxy, I was a second-year fellow. I had just had my second child. My views at that time were very different from what my views are now and what they are going to be 20 years from now. And the idea is that you review this document every year with your doctor, because your medical conditions will change, your perspectives will change. The people who you would have assigned as healthcare proxy might not be able to do that job anymore because of their own medical issues. Yes.
I was my mother's healthcare proxy, And one of the issues that we had was my mother lived alone and she had like home attendants taking care of her.
Mhm.
So to make it clear to them, the healthcare people, to contact me if anything happened, because we would put a copy on the door, on
Yeah.
my mother's door,
Yeah,
and one of my sisters kept taking it down because she didn't approve. So it was a problem for the family.
and that is why, you know what, the most important thing is that, when you do that healthcare proxy and that, document is shared with the appropriate people, like your primary care physician or her primary care physician, and the wishes are known, there's always gonna be a conflict in the family.
Yeah.
You have 3 kids, 3 different views, right? And, but the person who suffers is the one in the bed.
Mm-hmm.
And those 3 are also suffering because they don't know what to do. And if we have not been clear about what we wanted for ourselves, then they will suffer more because now they're acting on what they think and acting out of either guilt or acting because they don't know, they feel like if I take this decision, it's gonna be me the reason for killing my mom. So it is not them killing their mom, it is the disease. But that guilt is eating them, and so they're not able to make the right decision. So it is so important. I mean, I've seen children split over this, and then they don't talk anymore. But that's not what you want for your children after you're gone, right? You want them to be friends. You want them to be there for each other. And it's just, unless and until you state what you want, it's not gonna be carried out.
Well, that's what we did, we just kept the copy somewhere else.
Yeah,
Because
and you
we knew
make
she
sure.
was gonna take it if we posted it and just let the people that cared for mom to know, don't listen to her, you call me, because we got that paper hidden somewhere else.
Exactly, yeah. So, and as long as the physicians know, as long as the caregivers know, that is very important. We're gonna be involved in the care. So I think that brings me to the end of this topic. But I wanna leave you with a lot of hope. And I wanna tell you that if you do what we just talked about, you can change. I just gave a talk to the doctors of Holy Name Hospital yesterday. It was a CME talk, and it was a grand rounds, and I talked about obviously brain health there as well, but obviously more technical, more the pathophysiology and the genetics and all of that stuff. And you know, there is a study that came out in Lancet of 2024, which is a very good depiction of how we can, even if we have the genetic risk factor of somebody's brain getting dementia. So we have one gene that we have been able to identify that is linked to a higher risk of somebody developing dementia. That particular gene, even if you have that gene, but if you follow this, what we are talking about today, healthy eating, physical activity, keeping your mind active, socialization, learning something new, and minimizing your medications that have the side effect, smoking, blood pressure control, blood sugar control, cholesterol control. And the other thing is hearing and vision. You can reduce your risk by 35%.
What about stress?
Big one. Big one. And I'm going to leave that topic to our next speaker.
So it is on our list for our Inspire Aging. It will be our guest speaker in May.
Okay, so
Right here.
so there is actually I was just going to mention that because there is a study that just came out on stress and stress causing increased incidence of dementia, because obviously multiple reasons, increased cortisol, you know, stress is, but it's not just stress, it's your sleep that causes disruption to, the stress causes disruption to your sleep, and sleep causes, so obstructive sleep apnea is a very big risk factor for dementia as well. So treating that is very important as well.
Do you have any words of encouragement specifically around how to maintain the discipline to support all the things that you talked about doing? How that when you hear the inner voice, right, the good wolf, the bad wolf, and you're feeling lazy and you're not motivated about it. What do
And
you tell yourself?
I think if I had conquered, I would not be in the shape I am in. But it's there is no easy answer to this. But there is only two principles that I truly follow. Like if you're not well because you have a flu or you're having a pneumonia or you're having, your exacerbation of your chronic illness or whatever it is, go and rest. But if you're feeling lonely, anxious, or depressed, or you're feeling just bored, get up and move. Movement is the answer. There is no other. I mean, there are times in the evening when I'm sitting in my office and everybody's gone and I have to write all these notes for the day, and I'm not motivated, right? I'm not motivated to now go back. I've seen my patients, I've done the work, I think I've done justice for my day, and I should be able to go and leave, but I have to go and document. I think the only way it is when I get up, I go take 10 rounds in my own office. I don't even go outside, and then I can go back and do it. So I think movement is truly the most important thing that has shown to be the biggest motivator. And otherwise also I would say start small. Like you don't have to, first of all, you don't compare yourself to anyone. I think you should just compare yourself to what you did yesterday. Don't compare to somebody's walking 10 miles, somebody's walking 17 miles, that's good. But I think, if you did 5 steps yesterday or 5 meters yesterday, do a 6 today or 5.5 today, and if you fall, like let's say if you can't do it for 2 days, don't beat yourself over it. Like, right, don't beat yourself. It's okay. You're all allowed to cheat. Even as a diabetic, you can say, you know what, you have 21 meals in a day, in a week. If you are good for 18, you're good. Don't beat yourself for eating ice cream, on a weekend or when you went for a barbecue or something. That is not the idea. The idea is that you have your schedule, you have your routine that you're going to follow for majority of the week, and then if you fall off the ledge 1 or 2 times, it's fine. Your body is not going to complain and nobody else.